you or your friend or a relative has been advised an open heart surgery and you are worried how to prepare for the surgery. So please do not worry. In this episode of Traffic Ki Pathshala, I am your heart surgeon, your heart specialist, Dr. Vikas Kumar Keshri. And today our topic of discussion is how to prepare for open heart surgery. The preparation which is required for open heart surgery, I have divided them into three parts, three KYPs. The first KYP is know your procedure. Second KYP is know your prescription. And the third KYP, which is very important, is know your precautions or preparations. So we will discuss them one by one. Know your procedure. This is the first step. What is the surgery which has been advised, whether it's a valve operation, whether it's a bypass operation, how long the surgery will last, what will be the incision, how long will be required to stay in the hospital, how long of this will be in the ICU, what are the risks involved, what are the benefits involved. These all things are very important to prepare you mentally for the surgery. So you should discuss this with your surgeon. For all these things, your surgeon is your best guide and best friend. You should discuss them with him in detail. Please make sure that if you have any doubts, you have to clarify with them. You have all the rights to ask the questions and you should ask them and clarify all your doubts. The second KYP is know your prescription. This is very important and very vital part of preparation for open heart surgery. Because once you have been advised an open heart surgery, that means you have been a heart patient for quite some time and you are already taking some medications. Some of these medications may need to be stopped before open heart surgery. For example, ecosprin and warfarin. These are the blood thinning agents. These need to be stopped 3 to 5 days before surgery. So your doctor is again the best guide, best person to tell you what to do. Discuss with him what are the medicines which need to be stopped. There are some medications like diuretics which need to be given before the surgery for a few days. Discuss with your surgeon, discuss with the paramedical staff, know the prescription well. If some medicine has been advised not to be taken, you are supposed to make sure that those medications are not taken before an open heart surgery. Third KYP, which is very important, is know your precautions. So there are some precautions which vary depending upon surgery to surgery. If it's a valve operation, for example, you will be asked to meet a dentist, get your dental examination done. If there are some caries, get it cured. If it is a very big operation, you will be advised some breathing exercises and physiotherapy exercises which you are supposed to do at home. If suppose you have a coronary artery disease which is very severe, you will be asked not to exert, not to do a lot of physical activities. So discuss with the surgeon and get them clarified. You will be asked not to smoke. You will be asked not to take very heavy meals. So these are the common precautions which are advised before the open heart surgery. I will tell the most common precautions which are required for most of the open heart surgeries. You must take all the medication which have been advised to you on time, and you should not take the medication which have not been advised to you. You must quit smoking before an open heart surgery. There is certain time period duration during which the surgeon will assess whether you have stopped it or not. If some physiotherapy exercises have been asked, you must do. One very important and very vital part is you must not self-medicate. This is one common mistake most of the patients coming for open heart surgery do. They discuss with their friends and relatives, and there are hundreds of false beliefs that you take this thing, then recovery will be faster. You take this thing, then wounds healing will be faster. Please don't take proprietary medicines. Please don't take medicines which have not been advised to you by your surgeon, because these may have interaction with the drugs which are used during the surgery or during the anesthesia or during the recovery period. So no self-medication is one very important advice for you to take before to follow before the surgery. Now comes the day of operation. But before that, there are some more preparations which you will need to do before the surgery itself, but they will be required after the surgery. One very important precaution is that you have to make arrangement for a responsible adult to be present at home all the time. Most of us live in families. We have some relatives to take care of us. But in case the family members are busy in job or somewhere, you must have one adult full-time at home who will take care of the person. Most of the things patient will be able to do themselves, but there is a requirement of a responsible adult at home to assist him in the various day-to-day activities wherever assistance is required. Second precaution which may be required, because after the open heart operation, it may be little difficult to go for defecation in the Indian style latrines. So if it is possible, you must try to find arrangement for Western commode for defecation procedure, because that makes the life little easier for the open heart patients after open heart surgery. Now comes the day of operation, day of admission. This day also is very important. So very, very important that you must take all the documents related to your surgery to the hospital. We don't know which of the past tests may be important for the surgeons for the planning. So you must take all the scans, all the films, all the X-rays and CT scans and other films and documents with you, so that these can be reviewed whenever they are required. Second thing, you must take one responsible adult with you who will help you in paperwork at the hospital, so that you don't have to run around here and there. If you are getting the surgery done under some Mediclaim or insurance procedure, don't forget to take the papers of insurance, so that claim another process yourself. It is a very good practice if you make a checklist of all the things to be done. You may have a small pair of change of clothes for an undergarments, so that which may or may not be required at the hospital. All the medications which you have been advised, you must take them with you. And you should make very sure that you should not bring a very big crowd at the hospital, because after open heart surgery, infections are very common nowadays in some hospitals, and those are spread mostly by community members, those members who are around us. So we must not overcrowd the hospital, so that the problems do not arise. Again, wherever you have any doubt, you ask your surgeon, ask the paramedical staff, and follow their advices. Now comes the day of surgery. On the day of surgery, you follow the advice given by the surgeons and paramedics. Don't take any medication which you have not been advised, and sleep properly on the day prior to night. There are some things which you should not do. This do not is also a very important list which I have compiled. You must not smoke or drink alcohol before the surgery. You must not take a heavy meal before operation. Do not stress yourself too much. Open heart surgery is a very safe procedure nowadays, and we have been doing it with international leaders all over India now. You should not stress yourself, because this stress is going to hamper your recovery. One more important thing is, it sounds little laughable because you are listening to me on internet. Do not research about the procedure too much on the internet, because internet is full of misinformations. You must just find the general discussion about the disease recovery and other procedures, because your surgeon and your physician and your doctor is the best guide to guide you through the recovery process or operation procedure. So do not overstress yourself by trying to search about the things on the internet, because one, it is full of misinformation. Two, many times there is half information which may lead to unnecessary problem and confusions. These were the points how to prepare for an open heart surgery. In the next video, we will discuss how the recovery happens after the open heart surgery. I hope I have answered all your questions and queries related to preparation for open heart surgery. If still there are any doubts which are remaining in your mind, please ask them in the comment section. I will try to solve them. Till the next episode of Traffic Ki Pathshala, seeking your permission, your heart surgeon, your heart specialist, Dr. Vikas Kumar Keshri. Thank you.